Hi everyone, and welcome to Professional Care Workers Week 2022. Obviously, this week's happening in spite of the sad news regarding the Queen, but we felt that it is really important that we press forward with the week, as we've got a great lineup of speakers, all experts in the care sector, who can hopefully provide some really good insight into the really important work that's going on within the industry right now. It's also my last Professional Care Workers Week as chair of the Care Workers Charity, as at the end of this year, I'll be stepping down after 6 years as chair. Over the last 6 years, we've really built the charity from a small, well-intentioned group of individuals into a much larger charity. So I think 6 years ago, I think we were raising about £30,000 a year. Now the charity is raising much more than that, millions, over £1 million per year, and giving hundreds of thousands of pounds to people in crisis. I'm incredibly proud of the team and what they've achieved, and this week here, this Professional Care Workers Week, is just a great example of the fantastic work that Karolina and the Care Workers Charity team have done. I'll hand over to Karolina now, who will be taking us forward for the week. Thank you.
Thank you very much, Ben. Good morning, everybody. Thank you for joining us. And for those who are watching later on YouTube, thank you for your time. Like Ben mentioned, it's been an interesting time at the charity. Over the last few years, we have grown a lot, especially through COVID. We've helped a lot of care workers. First of all, I'd like to say thank you to everybody who supports us, who donates to us, who runs events, fundraising events for us, and for all of your kind words and support. It is really important that we continue to exist as a charity, because our work supports retention in the sector, our work supports care workers and their well-being, and through that, our work supports quality of care for people who draw on social care services. Let me just bring up a presentation that I'm going to share with you today in terms of impact of our charity over the recent time. Right, so as you can see, in 2020 and 2021, over the harshest COVID period, we awarded over 5,000 grants to the amount of over £3.3 million. That means we supported over 5,000 care workers, either financially, that is through crisis grants and COVID grants, or with their mental health, which is through one-to-one therapy or training mental health first aiders. So far this year, we have already awarded over 1,000 grants to the amount of over £500,000. As you can see, our work is very much needed. We need to continue supporting care workers, and especially with the cost of living crisis, we are getting more and more applications. So what's the split of our work between crisis, COVID, and mental health for this year? So you can see 451 crisis grants so far to the amount of over £200,000, 95 mental health grants to the amount of almost £80,000, and 464 COVID grants to the amount of over £230,000. Because of the cost of living crisis, in July alone, we awarded 55% more crisis grants than in the month of June. We've seen an increase of 22% in the number of paid crisis grants application compared to last year, 20% increase in total amount awarded in crisis grants applications as things have gotten more expensive, and 27% increase in the amount paid for grants towards daily living costs, again compared to next year, and that is very much tied into the cost of living crisis. COVID grant scheme, which has now been closed as we have run out of funds. We began it in April 2020, just in the first lockdown. We worked very hard to raise large amounts of money to support as many care workers as possible. That was mainly around sickness absence due to COVID, where there was no full pay available to care workers. That was also around shielding, where care workers with medical conditions had to stay at home. They were unable to work for at least 12 weeks. We were paying for that from around £250 to £2,000 for those who are shielding. And we paid out a huge amount in COVID grants since April 2020 of over £2.7 million. Like I mentioned, in terms of the COVID fund, that is now closed as we have run out of funding for that. And also because of the fact that due to government's guidance of COVID becoming part of our lives as well, we have absorbed some of that into our crisis grants. Our crisis grant scheme, this is our ongoing grant giving activity. That's why the charity was set up in the first place, to support care workers financially when in financial crisis. Grant applications are assessed on case-to-case basis. Care workers apply individually with supporting evidence. On average, we pay around £500 for those grants, but they can go up to £2,000, especially around funeral costs. And between 2020 and 2021, we paid out over £600,000 in COVID grants. At the moment, our crisis grants are on pause while we're working very, very hard to raise further funds for that pot. Because of the cost of living crisis, we had an increase in demand for our crisis grants earlier this year, and we decided to put a pause in applications until we have sufficient funds in place to make sure that when people apply, we can actually pay out all the eligible applications. We hope, and we are working very hard to reopen crisis grants as soon as possible, to make sure that we can support care workers. So if there is any way that you can support us in our fundraising, please do get in touch to help us build a pot for this grant giving activity, which is now especially important with how people and care workers are struggling with the cost of living crisis, rising bills, rising cost of food, and realistically speaking, everything is getting more expensive. So, like I mentioned, we are hoping to reopen crisis grants as soon as possible. In terms of mental health, we started that support last year. We partnered with Red Umbrella, and we are delivering two different things. That is one-to-one therapy sessions based on self-referral with a qualified therapist that are available to people working in care, and also by funding mental health first aider training for providers, where a provider can apply for one of the members of the team to be trained as mental health first aider, for care workers to have this peer support and also signposting in place of where and how they can access support if they're struggling with their mental health. In 2021, we put 40 care workers and managers through the course for mental health first aiders, and over 70 care workers so far have accessed our one-to-one therapy sessions. We've had incredibly positive feedback on both. We are trying to support as many people as possible with that. So if you think you or anybody on your team needs this kind of support, please get in touch with us. Going back to our financial support, just a bit on what people are using our grants for. So the way, just to remind you, the way our grants work, an individual applies with supporting documents, and then we pay into individual's account money. So it's a very direct support. We are able to process applications very quickly if we get all the evidence needed, because we know when somebody's financial crisis, they need that money there when they apply, rather than 2 months later. So the most common reasons for applying are daily living costs, especially with bills, funeral costs, home and car repairs, especially for people who work in home care, white goods where somebody's washing machine or oven breaks, and groceries. Unfortunately, we get a lot of applications from care workers talking about inability to feed themselves or the children, not being able to buy basics like beds for the children, or struggling with their rent, potential eviction notices being issued, etc. So we try to step in as quickly as possible and support people with those issues. In terms of some of the circumstances that care workers who apply to us face that lead them to applying for a grant, as you can see, the majority of it is around loss of income. That loss of income comes from different reasons. Sometimes it's sickness, and then people have to be off work for a long time. That includes mental health issues. Then we have loss of income because somebody's hours have dropped, especially in home care. Then we have loss of income around family circumstances where people have caring responsibilities. And for example, in COVID, there were issues accessing nurseries, etc., etc. Then it's illness and injury, people who are going through cancer treatments, people who've had back injuries, etc., that need support, maybe with some equipment, maybe with loss of income again. Then change in living, relationship breakdowns, domestic abuse. They often go together. When somebody is being a victim of domestic abuse, then they have to leave where they are living. So their living circumstances are changing. We try to support that. And then obviously there's bereavement as well. It was very difficult, and it still is, for care workers during COVID, when they were experiencing a lot of deaths with people they were working for. And sometimes that was really affecting their mental health to the point where they felt they had to take some time off work, and there is bereavement in the family. We support both care workers if a family member has passed away, but also members of the family of a care worker if a care worker has passed away. We have a supporter membership program for care providers where we encourage providers to support us with an annual donation. For that, we recognize those providers as supporter members of the charity. You are able to use our logo. We promote people on social media, and we try to work together to champion care workers, lobby for care workers, and try to change the sector for the better for everybody. So we visit services of supporter members as well. We have online calls with their managers. So we work very closely with our supporter members. People find it very useful to be a supporter member of the charity because they get, information about our work first before anybody else. They get opportunities to get involved with things like sessions on our Professional Care Workers Week, or these are also the people that we contact when we have media inquiries around our work. The program is on donation basis, so I just want to make it very clear. It's not a service that we provide to specific providers, because our grants are available to any care worker, not just care workers from supporter members. But supporter members are the providers that are committing to supporting our charity and the important work that we do to support the sector. And that's it really from me on our work. Please do get in touch if you have any questions, especially get in touch if you'd like to support us and our fundraising. There are many ways to get involved with us. Here you can see how to get, where to find us on social media. You can contact us through the website. And we are really hoping to work with more organizations in the sector. We have an exciting new fundraising opportunity coming up at the end of this month as well. And yes, please do get in touch. We have a lot of sessions throughout this week with some amazing speakers from the sector. So do please log in for more sessions this week. Give us some feedback, how you think they went, suggestions for what we can do next year, and get involved on social media promoting Professional Care Workers Week. Because Professional Care Workers Week is here to educate the sector, but to a bigger extent, the wider public about care workers being skilled professionals who do amazing work every day, that need a lot of respect and recognition for the work that they do, and the work that supports lives of very important people, of people who draw on social care services, and for the work that is incredibly rewarding, but also incredibly hard, and sometimes requires a lot of sacrifices. So please help us promote Professional Care Workers Week, and I hope you enjoy the sessions for the rest of the week. Thank you.